session. I welcome you all to the International Mental Health Fair 2021, organized by Psychologs Magazine. Our guest speaker for today is Dr. Asa Don Brown from New York, USA, and we will be talking about mental health practices based on Eastern principles in Western countries. East and West, as a human-made conceptual construct, has evolved to signify many social, cultural, political, economic, and psychological realities and meanings beyond its geographical references. Such conceptualizations both reflect and reconstruct our realities. Human beings have been looking after their health for thousands of years in countless ways. From Hippocrates proposing maintaining balance in the humors of our body to Ayurveda proposing the balance of doshas. Our understanding of health and medicine has continued to evolve over time. While there are differences to both schools of thought, the outcome is same. That is optimal health and well-being. And it is this optimal health and mental well-being that we will be discussing today with Dr. Asa Don Brown. Good evening, sir, and a very hearty welcome to you on behalf of the entire team at Psychologs Magazine, India. Dr. Asa Don Brown is an author, speaker, and clinician. He has worked as a clinician in Canada and the United States and currently practices from New York. He is currently pursuing Master of Liberal Arts, Creative Writing, and Literature from Harvard University. Dr. Brown completed his PhD in psychology in 2008. He is a prolific author and has published in a variety of professional and popular journals, magazines, and online columns. Some of his work includes interpersonal skills in the workplace, finding solutions that work, the effects of childhood trauma on adult perception, etc. Dr. Brown has held university faculty positions teaching incoming freshmen to those completing their graduate work. He has served a variety of professional boards and consulted various forms of government, social service agencies, legal practices, educational institutions, medical practices, religious organizations, and others in the field of psychology and psychiatry. He regularly consults and engages businesses and business leaders on topics that directly affect their fields. Ladies and gentlemen, once again, I welcome Dr. Brown to International Mental Health Fair 2021 and hand over the platform to you to present your views, sir. Thank you.
Thank you. Thank you. Thank you for inviting me to this important conference and for giving me an opportunity to speak. While the East and West think in profoundly different ways, the difference between our two cultures is becoming less and less noticeable. In fact, there are significant similarities between our two cultures when we consider mental health. The influence of the East is undeniable. Our cultures may have been originally shaped by the hunters, the gatherers, tribal people of that culture. But today, technology has forced the hand of change. Some of the most notable around concepts like individualism and collectivism. Whether you consider yourself to be independent and a self-contained person, or you consider yourself to be entwined and interconnected with other people, it is how we provide meaning and context to our lives that defines us. For those who see the world from an individualistic perspective, may not value the collective group. And more so, those that see it from a collective perspective may not value the concept of independence, of individuality. While there are many exceptions, people in the West are commonly associated with individualistic personalities, whereas those from Asian countries like India tend to be more collective. In 2010, an article in the journal Behavioral and Brain Sciences reported many intrinsic differences between the two cultures. The research explored the idea of individualism and collectivism and how these influence our modern thought and perspectives on life. A significant finding was that the Western cultures tended to value individualism and personal success over the group, whereas Eastern cultures' tendency for self-inflation appears to be almost completely absent in the range of studies across East Asia. When thinking from a cognitive and psychological perspective, the East has had a profound effect upon the way Westerners think. Today, the influence of the East has had even a greater effect upon how psychology and mental health functions. In the early structure of mental health, meditation, breathing, and other Eastern concepts were seldom used in the psychological practice. But today, a majority of mental health practices claim to use some form of meditation and breathing technique. The concepts do not end there, because while the collective conscious has been from an individualistic perspective in the West, and the East being the ultimate collectivism or collective society, there are indications that the East's cognitive approach to life and social orientation is becoming more prevalent in the West. If we only look back to the past year of 2020, there was a significant sign that the collective approach had crossed many borders on our globe. Another perspective of the East on mental health is the holistic approach to the way people think. Traditionally, this particular orientation was not mirrored in Western philosophy. Today, the concept of holistic orientation has become a part of the mainstream dialect in Western cultures. It is most evident in mental health practices. Research conducted in 2002 on the cultural factors influenced the mental health of Asian Americans by Elizabeth Kramer and Associates found that the research indicated that the Asian community was one of the fastest growing groups in the United States and in the West. Therefore, you understand why the Asian culture is having a profound effect upon the West. If we consider this statistic, then we should understand how the Asian culture has directly and indirectly impacted the West. The influence of Asian cultures on mental health has been significant, given that Asians place great value on the family unit. It is important to consider the role of the family in mental health. Asians have long considered the individual as being a part of the greater whole. Each individual has a clearly defined role and position in the family. Mental health practices have had to change accordingly. People in collectivist societies are commonly more holistic in the way with which they approach problems. The focus of the Easterner is commonly on the personal relationships, in the relationship to an immediate situation or event. Whereas Westerners, from an individualistic perspective, tend to focus on specific elements in the problem. And in the end, they may label the problem repairable or unrepairable, a matter of fact. An example might be, just imagine this, that you see a picture of two individuals. Perhaps the two individuals are standing side by side. As we look upon these two individuals, we could not help but notice a significant difference in their sizes. If we were to consider this from a Western perspective, we may think that the one individual as being quite domineering or in charge of the other individual. Whereas if we were to consider from an Eastern perspective, or what is often referred to as a holistic perspective, the two individuals might be considered a father and a child, or something less dogmatic. Our social orientation has been directly impacted by our culture, our cognitive and mental health perspectives. The mental health world of the East has had a tremendous impact not only upon the private practice, but moreover, on society in general. There is no doubt that the West is becoming a more socially driven and conscious society. After all, it is our social orientation that has had a profound effect upon how we see and interpret our worlds. Thank you.
Thank you, sir. I do have a few questions for you.
Okay.
You certainly mentioned in your speech that there has been a shift in perception. So, do you truly believe that there is a shift, an actual shift, practical shift in the perception of people in the West towards more holistic treatment methods that are mostly a characteristic of the Eastern treatment methods?
I certainly do. I have friends in various professions, as far as medicine and psychology, chiropractic, dental. In fact, I have a friend that teaches at a dental school in Washington State, and he has informed me that he has used approaches like mindfulness and approaches like breathing and even other approaches to have his patients use them before they see him, because he often has patients that enter the office. You probably understand that the dentists often have patients enter with a lot of anxiety and worries and fret over having a dental procedure done. And he's gone as far as even having some of them hypnotized. And that is just one example. In chiropractic, they use a lot of non-invasive and of course, they try to avoid using medicine. And so their approach has began to really adapt more and more of the Eastern concepts to help their patients deal with stress and anxiety, which is often carried in the body. Furthermore, as far as psychology goes, as a psychologist, I've seen it implemented more and more and more over the years. Breathing and now journaling is something that we both have our cultures, but breathing and meditation have been two of the key elements that I've used in my own personal practice for a number of years. But I've seen that become more adapted and more central to the approaches of many offices in psychology. When I first started out, it wasn't something that was as well received. It was on the fringe, but today it's the standard practice in most offices to use meditation and breathing and such techniques, and talking about locus of control and things of this nature, helping people focus on what is going on in their lives from a psychological or a mental health perspective.
Right. So you mentioned the concept of family. How do you think that has evolved in your society right now, the current situation?
Yeah. I've lived in two countries. I'm actually a citizen of two countries. I'm a citizen of Canada and the United States. And having had that experience of having lived about half my life in both countries, I've really got a good interpretation and impression of both cultures. In Canada and in parts of the States, parts of Canada, there are large Asian communities in Vancouver and in Seattle, where I did have homes. I was around a lot of those Asian communities. In fact, Vancouver is a large number. I think it was 33% that I read last are of some Asian descent in the Vancouver area. Anyhow, that really has helped define the culture of places like Edmonton, Alberta, where there's a large Asian community, or Vancouver, or Seattle. Well, having those large percentage represented in those communities has helped define and redefine our interpretation of family. One thing I've noticed, though, from Asian communities is family is a key element of life. Family is a very significant thing. I have a dear friend who is from India, and he and his father and his family, and he has shown me so many things that we don't see a lot of times in Western cultures. His father is now an aged individual, and he is taking care of his father. He's brought his father and his mother into his home. you don't see that a lot in the Western culture, or in my experience. I'm speaking for myself. Um, but I have seen a shift in that, and especially even in the last couple of years before 2020. But 2020 itself has caused a sort of a wave of need, really, for families coming together and needing to have one another. People that have lost their jobs have moved in with their parents. Parents have moved in with their children. And I think this is forcing that shift to even evolve quicker now than it had before. It was evolving. Families, let me clarify that as well. In Western culture, families love one another, but there's not always that ability to rely on one another, if that makes sense. And I think today you see people relying more and more upon one another, knowing that they can have a safe place to go, knowing that, and especially individuals that are dealing with addiction. There was a thought back in the 1980s. Nancy Reagan actually was really a key element of this, and just say no, against alcohol and drugs. And there's a long backstory to why Nancy Reagan and Ronald Reagan were for that approach, just to say no to drugs. We know, and kind of a hardline stance when someone had been an addict, we know that doesn't always work. And in fact, in many cases, it pushes individuals away from their families and away from their loved ones. Now, today, we understand that, we have to teach our children that, the effects, the negative effects and consequences of alcohol and drugs. But there's a loving approach, an accepting approach that I think that the Eastern culture has that perhaps the Western culture could gain a better understanding of. And that is, many people that I know in Eastern cultures, even if their child is an addict, they bring them into their home. They brace them. And that's something that we don't always see in the Western culture. Now, there are exceptions. Understand that. There are exceptions to the rule. There are families in the West that are nurturing and loving and want to show compassion no matter what is going on in their child's life. The same is true for Eastern cultures. I've known Eastern cultures or people from Eastern cultures that aren't willing to embrace their child no matter what. And so, there's no absolute to either culture, but there is this shift that I've noticed, that the importance of family has always been in the West, but the importance of family is changing the type of importance. I mean, as in, our responsibility. That's what I'm trying to say. Our responsibility to our family is changing. And that's not only changing how we see things from a mental health perspective, but from a political perspective. And it's becoming more of a collective society versus an individualistic society, which America and Canada were founded upon, those principles. You go out and you claim your land, you stake your land in the West. And those aren't necessarily, I'm part Native American, and those principles were for the Native Americans. Native Americans were more like Eastern culture and still are very much like the Eastern culture. So for me, I see it from two perspectives. I see it from a Western perspective and a North American perspective as far as my Native's ancestry.
So there's certainly a true merit to the fact that an absence of social support or family support does lead to a lot of psychological disorders and imbalances. And I think 2020 has really taught us this sense of community for everyone all around the world.
Yes.
So there's certainly merit to that. I do have one more question. I once read an article stating that a lot of researchers used to believe earlier that anxiety and depression were underreported in Asia, until an Australian psychologist by the name of June D. Waugh disproved this by proposing that rates of schizophrenia are also similar in the East and the West. And then they proposed that these differences were due to the differences in emotional disorders were due to the way they think about and respond to emotions. What are your opinions about this?
I've read a lot of research on that, and and there is evidence that there are more prevalent psychological disorders in various pockets of the world, and even in the US and then in Canada. You can go from one community to the next and find particular disorders that are more apparent than others. And I think a part of that is, and this is for the West especially, is that you've got to understand that the West is sort of a melting pot. It's an amalgamation of various cultures that have come together. But yet, in the West, we still have communities within communities. We have large pockets of Jewish communities. We still have large pockets of Italian community. So while they've come together, there still are those communities within communities. And so the social disorders, the psychological disorders have come with them. In parts of the states, you can see some disorders. What might be considered a disorder in New York, or say in Louisiana, may not be reflected in either of those two communities. In parts of the South, speaking in tongues in some of the Pentecostal movements is not an unusual thing to see in parts of the southern states. We may not interpret that as a psychological or being an issue if we were in those parts of the communities. But if you were in other pockets of the country, you would interpret that social concept as being disorder. As far as east to the west, though, I think there are significant disorders, or disorders that are more prevalent in one culture versus the other. And I think a part of that has to do with what is going on politically, what has gone on politically. You look at Israel and you look at many of the countries are surrounding Israel, and there's no doubt that there's a large prevalence of traumatic stress. That stress is due to years of violence, years of heartache, years of trauma. And, you're going to have a higher percentage of individuals that respond differently. Although, let me back up there for a minute. And that is, we know that people that endure long-term trauma often are more resilient than people that endure the effects of immediate trauma, such as September 11th here in the United States. When we had what happened in New York City, the effect on people was more profound than someone that is in an area that is war-torn, is one example. As far as disorders like schizophrenia and other prevalent disorders, from what I understand, from what I know, is that there are, again, niche pockets of disorders. And I think a part of that is not only mental health issues, developmental as far as nurturing, but you also have to look at the organic factor in that. Because we know that something like schizophrenia has an organic component. There's a brain relationship to that. So you can't, so perhaps there's a family, and we know that it can be passed down genetically. So we have to understand that some psychological disorders may be family-based, may be culturally based, if that makes sense. And so even here in the States, you find pockets of communities. I told my wife once that I look at communities this way. Each community has its own personality. And some communities we love, and some communities we'd rather not know. And, I've known communities, and I've not conducted research on this. One day I'd like to, and write it up. But I do believe that there are communities that there's a prevalence of narcissistic personality. And I've seen that firsthand. I've actually documented a lot of that in the different communities I've been in, where there's a prevalence, a dominance of particular disorders. Again, I think it can a lot of times be an organic trait that's been passed down, but also it's nurtured within a community. An example of that, I'm new to New York. I've been here 7 years. And there are words we use in cultures, right? I've lived in all time zones in North America, except Alaska. And I have witnessed and I've heard different dialect and the way we pronounce things. I've again I lived in British Columbia before moving here on the west coast of Canada. Lived in Seattle as well. I now live on the East Coast. And it's interesting when you hear people speak, and this goes to the heart of the matter. And that is, I've heard people say things and it humors me because I'm a fan of Sherlock Holmes. And, my dear Watson, he speaks of something being elementary. Well, here in this community, they speak it differently and it's elementary. You take that little idea, and it shows how one person along the way, it's very, very much a cultural accepted way of saying things in the southern part of New York. It's the way you say it here. And at some point, someone came here. Maybe a family came here. Maybe families came here from a particular culture. And that's how they pronounce that. Now that's become an accepted way of saying that. We're out of the norm in the way we say that. And so that's how psychology works. That's how mental health works, is we'll often transplant things, whether it's organic through having relationships and having offspring, or through just our social interactions. Psychologically, we can share our interpretation of the world and how we see things. And sometimes our interpretation of the world may not be exactly right. And so that has an effect upon how we see the world. Let me give you an example there too. And that is, if I see the world through a skewed view, if I see the world through hazy lenses, then my world may not be so beautiful. But if I see the world through rose-colored glasses, if I see the world through a rainbow, I may see the world as something that I want to seize, something that I want to obtain, something I want to be a part of, something I want to enjoy, I want to embrace. And so it's how I see the world that's going to affect those around me. And so, when it comes to psychology and mental health, one thing we always have to be careful of is that there are some disorders that there's no debate. They are organic. So it's not that the family has caused this individual to have this particular disorder. Rather, that particular disorder came on because of an organic issue. Now, some organic issues can be triggered by traumatic stress or anxiety or extreme trauma, but disorders aren't created by nurturing and what's going on in their environment. There are disorders, though, that are created by nurturing and what's going on in one's environment. And so, we have to understand that there's no one disorder that I think that disorders, you have to look at the individual community within any community or within any country to understand that these disorders, there's a reasoning that these disorders have a prevalence in that community, in that pocket. And we have to look to the community, look back in the history to understand why there's such a prevalence of that particular disorder. Whether it's bipolar disorder, why it's borderline disorder, or what other disorder. Why is there that particular prevalence? Is there an organic issue? Is there a culture issue? What has caused that disorder to become so prominent in that community?
Right. We discussed about the evolution of the concept of the family in the Western culture. So, do you think it has some effect on the divorce rates in the Western culture?
The prominence, yes, yes, I do. Um, one article I read here recently was saying that, especially for arranged marriages, we see less divorce around arranged marriages than we do cultures that don't have arranged marriages. Now, why is that? Is that good? Is that bad? Now, I'm not here to catch judgment either way. What I am going to say is what I understand, what I've read, and that is I think in cultures that divorce has been permitted, has been made law or acceptable, I think it becomes an easy way out a lot of times. It's become the fast food society. And if I can't get along with him, if I don't get my way, then I'm going to divorce him or I'm going to divorce her. It's a quick fix. And we all know, we've seen in the media people that are, in the spotlight that are married 6 months, 6 days, 6 hours, and they're divorced. There's no commitment. There's no loyalty. And I do think that the Eastern culture has, that is one thing. I think there's an emphasis on commitment. I think there's more of an emphasis on commitment and on loyalty and seeing things through from those that I know. Now, I've known people from Eastern cultures that have been divorced, as well as I've known people from Western cultures that have been together multiple years. There is no absolute, but again, from what I know and from my own personal interaction and from research, that Eastern cultures do have a longer commitment to these relationships. And I think that is culturally, there's a cultural bias there. It's culturally based. And the emphasis on family, I think, is the reason we see cultures, see relationships last longer in Eastern cultures.
Right. We have one last question from our live audience. It is from Dipanshu. He says, in India, we use Western concepts in clinical practice. What is the situation in study of Eastern philosophy and theory in Western practice, Western clinical practice?
So in Eastern cultures, you use Western philosophies.
That's right.
Well, it is. Now, it's been a number of years since I obtained my education, but I can tell you, even back then and today, from being involved as a professor, there is a greater emphasis on training and teaching various concepts. The lotus of self-control. Again, back to the breathing and meditation. These are just simply a part, a small part of what is being taught in today's practices. The emphasis on Eastern cultures and on even in medicine. I know that a number of folks, associates of mine that are in traditional medicine, have gone the way of using Eastern medicines, Eastern philosophies, in order to avoid using pharmaceuticals, so that that their first go-to is not necessarily a pharmaceutical, but rather some other means of helping this individual. But back to psychology and mental health, I think it is a good thing. I think that you're going to see more and more of that enter the stage of Western culture. And again, back to the number of one piece of research I read recently said that there are more people being born from Asian cultures in Western cultures today than have ever been. There's a larger group of Asian communities living in Western cultures than ever we've ever seen. And with that will come these influences. And with those influences, it will have a profound effect upon how we practice in mental health. And so, and vice versa, those things will be taken back to some Eastern cultures, the Western philosophies. But I don't see that as a bad thing. Actually, I would prefer, I'm one of those that if I can try an Eastern remedy, or if I can try something that is not for my own person, or when I've worked with patients, if I can try something that is holistic, I'd rather go to a holistic approach before I'd go to a pharmaceutical approach. And so, I think that is one of the greatest benefits to each Eastern culture, is that this holistic approach has really become a mainstay and a very prominent aspect of mental health.
Thank you, sir.
Thank you.
So it was a wonderful discussion. I wish we could go a bit longer, but due to time constraints, I would have to really conclude it now. I'd like to express my heartfelt gratitude towards you for gracing this event and sharing with us your knowledge and experience. It was a sheer delight to have engaged in such a stimulating conversation with you, sir. I extend my gratitude to Dr. Arvind Dota to provide the platform for such a unique and enriching experience. A special thanks to the entire Psychologs team for their extraordinary efforts, without which all of this wouldn't have been possible. Lastly, thanks to the audience for their active participation. Wish you a very good day ahead.
Thank you. Thank you for this opportunity.